Good afternoon, students. So, today's lecture of surgery in that we was learn the orthopedic. In the lecture of orthopedic, in the previous lectures, we was studied about the fractures. So, from the today's lecture, we will start with the fractures in the special situation. Fractures in the special situations are seen in the fractures in the children, epiphyseal injury, pathological fracture, and fatigue or stress fracture. Fractures in the children are different from fractures in adult for the following reason: that complete fracture are rare due to the thick periosteal sleeve, and for the same reason mentioned above, that is thick periosteal sleeve and greater elasticity of the bones of the children, buccal fracture, that is torsus fracture, and green stick fracture are common in the children. Fracture displacement more relatively less common. Fracture bleeding is also less. Avulsion fractures are more common because bone gives away much earlier than the ligament. Disruption of the epiphyseal plate are relatively more common because they form the weakest portion of the bone in the children and account for nearly one third of all the childhood fractures. So, a pediatric fracture unites faster. Differential periosteal activity causes a better remodeling, which are more likely in the younger children. The nearer the fracture to the epiphyseal plate, and if the deformity is angulated in the plane of the joint movement. So, all the tissues in the children not only heal well but rapidly too. The joint stiffness or buck tear in adults and rarely happen in children. Incidence shows that fracture accounts for 10 to 25% of all the injuries in childhood. It is common between the 11 to 14 year of the age. Boys account for 62% of all cases. Fracture is distal end of the forearm is the most common skeletal injury in the children, contributing 25% of all fractures in them. And etiology shows that fall are more predominant cause in children, and traffic accident, especially bicycle accident, account for 12% of the cases. So, supportive sporting activities contribute 21%. Then the birth fracture, that is, the clavicle is the most commonly injured bone during the birth, account for 40 to 50% of all birth injury, followed by brachial plexus injury, which is usually during instrumental rotation of the vertex. The humerus injured during breech delivery, and the femur in that order. So, the pathological next is a pathological fracture. The condition leading to pathological fracture could be generalized, for example, osteogenesis imperfecta, metabolic disorder, etc. Then localized to one limb, that is fibrous dysplasia, localized to the lesion, for example, benign cystic condition of the bone, infection, benign and malignant neoplasm, etc. Then, pathological fracture usually result from severe trauma. Child abuse, that is battle baby syndrome, in the 80% of the child abuse takes place in less than 2 years of the age. And stress fracture are are not very common, which is seen in the tibia, neck of the femur, etc. So this is a diagram of the X-ray which shows the green stiff fracture of the radius and ulna. This is a type of incomplete fracture seen exclusively in children. Here one cortex is broken and other is intact. So this is a diagram of the green stick fracture in the children. Then buccal fracture or the torus fracture. This is common in metaphyseal region and is due to the comprehensive force. So in this fracture, cortex is buckled, common at the distal radius, and the treatment is by plaster cast or Futura type of wrist splint. Plastic bowing that here bone deform but does not break. Seen in paired bone. And there is a microfracture of the concave side. So in the plastic bowing there is a bone deformed but there is a not breaking of the bone. So it is seen in the paired bone and there is a microfracture of concave side. And the torsus fracture shows that it is the commonest metaphyseal region due to the comprehensive force. And in this fracture, cortex is buckled and common at the distal radius and the treatment of is by plaster cast or sutural type of the wrist splint. Then the pattern of the fracture. It is simple or compound. The latter variety is rare. The fracture in either case could be transverse, oblique, spiral, comminuted, or segmental. Clinical features are the child complaint of the pain, swelling, deformity, and the child loathes to use the affected extremity. And investigations required are AP and the lateral view of the plain X-ray of the affected limb is enough to make an accurate diagnosis in children. So treatment that problems of the treatment is the younger child is fretful and difficult to